Welcome to the VetPMP webinar on how to enter a prescription. When entering a first prescription, there's a few things we need to think about before we actually enter the prescription for the controlled drug into the VetPMP. The first is you want to confirm that the pet has a microchip. The system is based on a microchip number, so a microchip is essential to using the VetPMP. The microchip does not need to be registered for it to be used in the VetPMP system. Once we have verified that the pet has a microchip, the second step is to inform the client about the VetPMP and make sure we have a signed release. The client only needs to sign the release once per clinic. The signed release should be kept in the pet's medical record, just like the rest of their medical history. At this point, we're going to look up the pet in the VetPMP. We have gone through a webinar on how to do this, so if you want to review, I recommend reviewing on that webinar. At that point, if they're new to the system, you're going to enter the patient. If it finds it, at that point, we're going to be able to just enter the prescription. So to start from the top, you're going to go to vetpmp.org. You're going to put in your username and password. If you do not have one, I recommend reviewing the webinar movie on how to set up an account. The next thing we're going to do is click on Find an Animal. We're going to enter the pet's microchip number. Again, there's three ways we can do this. We can free type, we can copy paste from an electronic medical record, or if you have a barcode scanner attached to your computer, we can scan the barcode that comes with most microchips. At this point, the system will look for the pet, and it will either give you the message here on the left that no ID was found, in which case we'd need to set up the pet in the system, or it will show that it found your pet. At the bottom of the pet's page, there is a button called Add a Prescription. You will need to click on this. At this point, it is going to ask you for the date of the prescription. It will auto-enter today's date, but you can backdate this prescription date if needed. Second, you're going to pick the drug name from the drop-down list. And the third, you need to enter the prescribing veterinary's license ID. Click Next Step, and it will take you to a screen where we have just 6 more pieces of information to kind of work through. It will auto-enter the clinic's name. If your doctor works for more than one clinic, please verify the correct clinic has come up. If not, use the drop-down arrow next to the clinic name field to select the correct clinic name. If the correct clinic name is not showing up, your doctor will need to add this to their profile. The second step is you need to pick an action. You have 3 choices. 1, you can do a written prescription. Second, you can do a prescribe and dispense. This is where you're actually sending the medication out from your clinic. Or the third is a decline to prescribe. If after reviewing the pet's history, medical record, you feel there is a concern to prescribe, you can mark this as a decline to prescribe. At this point, you're going to select the concentration. You're going to enter the quantity, the unit of measure, which would be like tablets, capsules, milliliters, and the directions for use. This can be written in vet language. This is something that's only seen by the veterinary community and not clients. You will then need to enter your number of refills. Please remember that level 2 controlled drugs are not allowed to have refills, so this field will be closed. On level 3 prescriptions, they can only have a max of 6, so it will limit the number based on the level of the controlled drug as a helpful reminder to the controlled drug federal laws. At this step, you're going to need to hit the Next button. Here is an example of one that has been completed. Again, I had selected phenobarbital. It automatically knows the level of the controlled drug. I prescribed it from the Mora Clinic. I decided to prescribe and dispense. I selected 60 milligrams. I sent 30 tablets home, and I wrote out the directions allowing 11 refills. At this point, you'll get a pop-up message that says prescription was added. Congratulations, you have entered your first prescription.